we are joining with medical educational video series. First, we are learning about diabetes mellitus. So, what is diabetes mellitus? It is defined as a collection of diseases of abnormal carbohydrate metabolism that are characterized by hyperglycemia. Did you know there were 5 types of diabetes mellitus? In diabetes mellitus type 1, autoantibodies destroy islets of Langerhans in pancreas, which causes no production of insulin, making young children insulin dependent. Diabetes mellitus type 2 is the most common and is characterized by hyperglycemia due to progressive loss of insulin secretion in beta cells superimposed on a background of insulin resistance. Maturity onset diabetes of young, which inherit genetically, and it is a rare form of disease. It happens due to mutation of single gene. There is a 50% possibility of inheritance to offsprings. Latent autoimmune diabetes in adults, sometimes called diabetes 1.1, usually gets over the age of 30 years and insulin production will be stopped, like the type 1 DM. Gestational diabetes mellitus. In gestational diabetic mellitus, glucose intolerance is first recognized in pregnancy. How are we going to diagnose diabetes mellitus? According to American Diabetic Association, 90% patients are suffering from type 2 diabetic mellitus. We can diagnose diabetic mellitus by fasting blood sugar, HbA1c and OGTT in asymptomatic patients, and in symptomatic patients it's diagnosed through random blood sugar. American Diabetic Association criteria for diagnosis of diabetes as follows. For fasting blood glucose, it should be equal or exceeding 126 mg per deciliter, and the fasting should be no calorie intake for at least 8 hours. For HbA1c, it should be equal or more than 6.5, and for oral glucose tolerance test, it should exceed or equal to 200 mg per deciliter at the 2 hours plasma glucose value. And for symptomatic hypoglycemic patients such as polyuria, polydipsia, and excessive weight loss, the random blood sugar can be used as a diagnosis method for diabetic mellitus, and the rate should be more than or equal to 200 mg per deciliter. I just wanted to talk a little bit about pre-diabetes. The same test used to screen for and diagnose diabetes can also be used to identify individuals with pre-diabetes. Pre-diabetes means there is a high risk of subsequently developing diabetes. In impaired fasting glucose, the glucose range between 100 to 125 considered as pre-diabetes, and in OGTT the 2-hour value is more than 120 and less than 200 is considered to be pre-diabetes. In HbA1c, the percentage of 5.7 to 6.5 is considered pre-diabetes. How the type 2 diabetic mellitus can be differentiated from other types of diabetic mellitus, especially the type 1 diabetic mellitus. Diabetic ketoacidosis is a special or more specific presentation for type 1 diabetic mellitus. And if there is a more prominent catabolic presentation or lean body habitus with no features of metabolic syndrome, or a personal history of autoimmune disease or strong family history of autoimmune disease, we might consider doing investigations for other types of diabetic mellitus, especially type 1 diabetic mellitus or autoimmune diabetic mellitus. There are several autoantibodies which we can use to diagnose type 1 diabetic mellitus. Especially, the first one is glutamic acid decarboxylase 65 and islet cell antigen 2 and zinc transporter 8. The common approach is to measure 2 or 3 antibodies, mainly the GAD65 and 1 or 2 of the others. As an extra fact, C-peptide also can be used for diagnosis of type 1 DM, but it is not usually used in routine clinical practice. If the level is less than 0.2 nanomoles per liter, it is suggestive of type 1 DM. Thank you for listening. If you have any questions, please mention in the comment section.